Chapter 11 Principles of Resuscitation. Objectives of this section: review cardiovascular and respiratory anatomy and physiology you learned in Chapter 4. Define the following terms: advanced life support, asystole, automated external defibrillator or AED, basic life support, cardiac arrest. Cardiopulmonary resuscitation or CPR, chain of survival, chest compressions, defibrillation, fibrillation, heart failure, pediatric patient. Resuscitation, ventricular fibrillation, ventricular tachycardia. Objective number 3, explain the most common causes of cardiac arrest for adult and pediatric patients. Number 4, explain the components of the adult chain of survival. Number 5, describe the signs of cardiac arrest. Number 6, explain the steps of performing single rescuer CPR on an adult, child, and infant. Explain the steps for performing two-person CPR on an adult, child, and infant. Explain the purpose of an AED. Describe the indications and contraindications for use of an AED. Explain the importance of minimizing interruptions in CPR. Demonstrate the proper technique for performing single rescuer CPR on a simulated patient in cardiac arrest. Alright, the chain of survival. The chain of survival depends on immediate recognition of cardiac arrest and activation of the emergency response system. Early CPR with an emphasis on chest compressions is critical. Rapid defibrillation, effective advanced life support, integrated post-cardiac arrest care. Alright, cardiac arrest occurs when the heart stops beating or is in a rhythm unable to support life. Arrest recognized and 911 is activated. CPR is immediately initiated with the emphasis on quality compressions. Defibrillation. This is an electric shock delivered to the patient's heart. Automated external defibrillator or AED is an external electrical device that can detect certain abnormal heart rhythms and deliver a shock through the patient's chest. Advanced life support. This is pre-hospital emergency care. The use of intravenous fluids, drug infusion, cardiac monitoring, defibrillation, intubation, and other advanced procedures. This is what your paramedics are going to be able to provide. Integrated post-cardiac arrest care, including neurological support and therapeutic hypothermia. Alright, so here's some things to think about. What is your role as an EMR within the chain of survival? What role in the chain does the EMR represent? What is the benefit of advanced care? How can the EMR help promote post-cardiac arrest care techniques? These are just some things to think about as we continue with the lecture, guys. Circulation and CPR. The heart is the center of the circulatory system. It is the pump that moves blood around the body. Common cause of cardiac arrest is a heart attack. Sometimes these things can be confused. When somebody says they had a heart attack, sometimes people think they're in cardiac arrest. That's not the case, but a heart attack can lead to cardiac arrest. Signs of cardiac arrest are the patient being unresponsive, no breathing, no pulse.
The four chambers of the heart alternate between contraction and relaxation in a concerted fashion. This pattern is called the cardiac cycle. During the cardiac cycle, the heart chambers beat cyclically to.
This is an animation of the The structures of the heart and the flow of the blood through the chambers are um, represented in this figure. It's also in your book.
The cardiac cycle begins when blood fills the atria. The right atrium is filled by veins that carry deoxygenated blood from the body, and the left atrium is filled by the pulmonary veins which carry oxygenated blood from the lungs. The atria are now filled with blood, while the ventricles are relaxed. The cardiac cycle continues when the atria contract, forcing blood into the relaxed ventricles. Valves prevent the backflow of
Circulation and CPR. Cardiopulmonary resuscitation or CPR. External chest compressions and ventilations. Perform chest compressions to circulate the patient's blood. Circulate oxygenated blood to the brain and help delay onset of biological death. Ensure and maintain open airway. Breathe or ventilate the patient. Alright, CPR, how it works. Compressions cause increased pressure in the chest cavity, forces blood out of the heart and into the arteries to circulate to all parts of the body. When compressions are relaxed, pressure is released. A vacuum is created, causing blood flow back into the heart. Breath provide oxygen to the patient's blood. Alright, take a look at this figure. It's 11.2 in your book. During CPR, pressure in the chest cavity caused by compressions forces blood into circulation. If you look at the top section of this image, you've got compression. You're pushing down on the heart and associated structures inside the chest, creating a positive pressure. When you release, a negative pressure is created. When do you begin CPR? The patient is unresponsive, not breathing, and does not have a pulse. You check for a pulse by assessing the carotid artery in the neck of the adult or child. Assess the brachial pulse in the arm of an infant. If you cannot locate a pulse, activate 911, get somebody to bring you an AED, and begin chest compressions. Use the carotid artery to assess for the presence of a pulse in an unresponsive adult or child. This figure just shows that. And use the brachial artery to assess for the presence of a pulse in an infant. Locating the CPR compression site. Place the patient face up on a firm surface. Kneel at the patient's side near the shoulder. Quickly move or remove any clothing that may be covering the patient's chest. This is just an image showing somebody removing the individual's shirt. Place the heel of one hand on the center of the patient's bare chest, right between the nipples. Put the other hand on top of the first hand. This is demonstrating that. Place your other hand on top of the first. Either extend or interlace your fingers. That's personal preference. Make sure your elbows are locked and your shoulders are directly over your hands. Hand positions at the CPR compression site. This is with the fingers extended. And this is with your fingers intertwined. Position your shoulders directly over the compression site. This gives you the best opportunity to adequately compress the chest. Make sure your elbows are locked and your shoulders are directly over your hands. This is just a view from the side. Both knees on the ground about shoulder width apart. Deliver compression straight down. Release pressure on the chest and allow it to completely recoil. Provide sets of 30 compressions and pause briefly to provide 2 breaths. Providing ventilations during CPR. After each set of 30 compressions, provide 2 breaths. Position yourself either at the top of the patient's head or at the patient's side. Deliver each breath slowly over 1 second. Allow the chest to deflate between breaths. Do not overventilate the patient. This is the image of the rescuer delivering ventilations from the side of the patient's head. Delivering ventilations from the top of the patient's head. Rates and ratios of compressions and ventilations. You're going to deliver compressions at a rate of at least 100 per minute. Avoid interrupting compressions for longer than 10 seconds. Provide ventilations at a ratio of 2 breaths for every 30 compressions. Deliver each breath over 1 second. Hands need to be in the center of the chest, over lower half of the sternum. Compress the chest 2 inches, hard and fast at a rate of 100 per minute. Chest rises and falls during ventilations. You need to limit your interruptions of compressions. Alright, here's a scenario for you. You respond to a local gym and find a 50-year-old male who had suddenly collapsed. Using an adult mannequin, demonstrate how you would proceed. We're going to do this in class. Alright, adult and child CPR. This is table 11.1. It's going to be found in your book. I'm not going to go over this entire table, but I'm going to hit some high points. You're going to need to study it in your book for the finer details. So adults, 30 to 2. Depth is going to be at least 2 inches. Child is also 30 to 2. 1/3 the diameter of the chest, or about 2 inches on the child. And your compressions are going to be at least 1 minute. If you've got 2 rescuers for the child, you're going to change over to 15 to 2 for your compression rate. All right, the infant is going to be about 1.5 inches on the depth, at least 100 per minute on the rate. It's 30 to 2 with 1 rescuer and 15 to 2 with 2 rescuers. All right, so just keep in mind on the child and infant, if you have 2 rescuers, the ratio changes from 30 to 2 to 15 to 2. Adult, it's the same regardless. All right, 1 rescuer CPR. You're going to position the patient face up on a hard surface. Check for responsiveness. Check for breathing. Check for a pulse. This is him checking to see his patient's level of responsiveness. Patient appears to be unresponsive. Looks for signs of breathing. If not breathing or only gasping, call 911. Check for a carotid pulse for at least 5 seconds, but no more than 10 seconds. Guys, keep that in mind. At least 5 seconds, but no more than 10 seconds. That's going to be on your test. All right. If no pulse, begin compressions. Deliver 30 compressions. Open the airway using a head tilt chin lift maneuver or jaw thrust maneuver. Give 2 breaths. Do not interrupt CPR for any longer than 10 seconds. Then continue CPR. Alright, so like we said, if there's no pulse, start CPR beginning with chest compressions. For chest compressions on a child, use the heel of a hand. Provide 30 compressions at a depth of 2 inches and a rate of at least 100 per minute. After 30 compressions, open the airway and provide 2 ventilations. Each breath should be delivered over about 1 second. Watch the chest and make sure you get adequate rise and fall. If a patient has a carotid pulse but no respirations, provide one breath every 5 to 6 seconds. This is going to be about 10 to 12 breaths per minute. 2 rescuer CPR. Alright, with this technique, you're able to minimize the transition time between ventilations and compressions. You're going to activate the EMS system. Get in position next to the patient's chest. Alright, 2 rescuer CPR compression ratios for adults is 30 to 2. For children, it's 15 to 2. Something you need to take note of. 2 rescuer CPR for adults is 30 to 2. For children, it's 15 to 2. Alright, change positions after 2 minutes or 5 cycles. The first rescuer positions the patient, determines unresponsiveness, and looks for signs of breathing. If there are no signs of breathing, send someone to call 911 and get an AED. Then assess for a pulse for no more than 10 seconds. Guys, you are the rescuers, so you're going to be there after 911 has been activated. If no pulse, the second rescuer locates the compression site and begins compression. Deliver 30 compressions at a rate of at least 100 per minute. During 2 rescuer CPR, compression should be paused to allow for the delivery of ventilations. After each set of 30 compressions, the first rescuer provides 2 slow breaths. The second rescuer should pause compressions to allow for adequate ventilation. Alright, here's a scenario to think about. You and your partner respond to an apartment complex where a 56-year-old female has collapsed in the lobby. Using an adult mannequin and working with your partner, demonstrate how you would proceed. We will go through this scenario in class. Infant and neonatal CPR. Alright, infant is baby from birth through 1 year of age. A neonate is an infant less than 1 month of age. Alright, positioning the infant. You're going to place them face up on a hard flat surface. Maintain head in neutral position. You may have to pad under their shoulders with a blanket or a towel just because their head is larger in proportion to their body, and that can cause their airway to be closed when they're laying flat. This is just an image of someone placing a towel under the infant's shoulders. It allows for the airway to be in line. Alright, open the airway. If there is no spinal injury suspected, tilt the head with one hand into the sniffing position. If there is a suspected spinal injury, use a jaw thrust maneuver. Assess breathing. Look for rise and fall of the chest and the abdomen. Checking for a pulse. Feel for a pulse at the brachial artery. Brachial pulse point is located on the medial side of the arm between the elbow and the armpit. Alright, ventilations. With the airway open, using a barrier device, provide ventilations at a ratio of 1 breath every 3 to 5 seconds. Do not overinflate the lungs. If you do not see chest rise after repositioning the airway, begin chest compressions immediately. External chest compressions on the infant. You're going to apply compressions to the lower half of the sternum or breastbone. For a single rescuer, place 2 fingers on the sternum. For 2 rescuers, encircle the chest with both hands and use thumbs to compress. For compressions on an infant, place 2 fingers on the center of the chest, 1 finger width below the nipple line. For an infant, place 2 thumbs side by side on the center of the chest, just below the nipple line. This is only when you've got 2 rescuers. For newborns or neonates, place 2 thumbs one on top of the other in the center of the chest, just below the nipple line. Again, this is for 2 rescuers. Alright, infant CPR techniques. Infant CPR rates and ratios. Compressions need to be at least 100 per minute. This is true for adults, children, and infants or neonates. For a single rescuer, compressions and ventilations are at a ratio of 30 to 2. This is where it's different. For 2 rescuers, compressions, ventilations at a ratio of 15 to 2. Always remember for children and infants, if you have two rescuers, the ratio changes from 30 to 2 to 15 to 2. Caring for a neonate. Neonatal cardiac arrest almost always due to inadequate breathing or asphyxia. ABC sequence is recommended. Keep the infant warm. Right, you are alone and the first on scene at a home where a hysterical mother is unable to awaken her infant. Using an infant mannequin to demonstrate how you would proceed. We'll do this on class next week, guys. In the process of delivering CPR, another EMT arrives. Demonstrate how you will continue efforts. Again, we'll cover this in class next week. All right, ensuring effective CPR for all patients. Place the patient face up on a hard surface. Compress smoothly to proper depth. Relax pressure between compressions to allow the heart to refill. This means completely let the chest recoil. Use correct rates and ratios. Use an appropriate barrier device. Limit necessary interruptions. If ribs crack, do not stop CPR. This is very common, especially in elderly individuals. So if you do start hearing ribs cracking, check the position of your hands. Reposition them properly if needed. Continue with CPR. Fractured ribs will heal. Stopping CPR will result in death. Do not try to force excess air out of the stomach. This can make a patient vomit. If the patient does vomit, stop CPR. This is something that you have to really look at. A lot of times you're going to have some secretions coming out of an individual's mouth when they have gone into cardiac arrest. You don't want to cause aspiration. However, just because you've got a few little secretions coming out of somebody's mouth does not mean you want to stop CPR. We'll discuss this a little bit further in class or in our QA session coming up on Monday. What would happen if blood were impeded in its flow? Example, a heart chamber not working properly. How would this problem manifest itself in your patient? All right, special situations for CPR. Moving the patient. Place cardiac arrest patient on a long spine board when available. It allows for easy transfer to stretcher and provides a firm surface when doing chest compressions. The best way to work a cardiac arrest is going to be at the location it occurred. I have to check with local protocols and how their protocols dictate running a cardiac arrest, but like I said, common practice is working the cardiac arrest where it's at. All right, CPR and trauma. A lot of times you're going to have severe injuries to the face, crushing injuries to the chest, head, neck, and spinal injuries. Injuries should not prevent you from starting CPR. If you delay or do not start CPR, the patient will certainly die. All right, trauma. Patients must be moved to hard surfaces and placed on their backs. Attempt to move the patient so the head stays in line with the body. Do not delay CPR to stabilize the neck and spine with collar immobilization devices. Use a jaw thrust maneuver if possible. You got to keep in mind, if this individual sustained trauma and you're performing CPR, they are clinically dead. At this point, you've got to do everything you can to try to bring them back from this clinical death and delay biological death. So while cervical spine is important, that's not our priority right now. Hypothermia. No attempt made to rewarm the patient in the field. Resuscitation should continue until the patient can be rewarmed. Not considered dead until the core body temperature rises and remains unresponsive to resuscitation efforts. What they're talking about here is if you've got somebody that's been submerged in a cold environment of water, or they've been outside and you find them in cardiac arrest, you are going to continue resuscitation efforts until you get them to the hospital and their body can be rewarmed. Dads used to tell us when I was in paramedic school, they're not dead until they're warm and dead. So it's just something to keep in mind. If they are hypothermic and they've been in a cold environment, we're going to continue resuscitation until we can get them somewhere and get them rewarmed. Stopping CPR. This is something your paramedics are going to be dealing with more on scene than you guys. So a medical director physician at scene may order you not to begin CPR, or if obvious signs of prolonged death. Provide CPR unless written advance directive is present. So the takeaway from this, guys, is if you get on scene and they don't have any obvious signs of trauma that's incompatible with life, or they don't have any of the signs of obvious death that we discussed in a previous chapter, always start CPR. Let the paramedics and EMTs, when they get on scene, evaluate the situation a little bit more. But you can't go wrong with starting CPR, though. Alright, so you're going to continue the CPR until the patient regains pulse, then provide ventilations only. Spontaneous pulse and breathing begin, you can stop CPR. Equally or more highly trained members of the EMS system can continue in your place and take over the call. You can turn the patient over responsibly for patient care to a physician. You are just physically exhausted and no longer able to continue. If you're there by yourself and you've been performing CPR for 15, 20 minutes, at some point you're physically going to be exhausted and you may not be able to continue. At this point, you've done everything you can possibly do, and if you can't continue, you just can't continue, and you have to be able to stop. All right, here's something to think about. You respond to a local pond where a teen was pulled out of the water after falling through ice. It is unclear how long he was underwater. He appears blue and has no pulse. Your partner suggests calling it, or just deciding he's dead and leaving the body with the police until the medical examiner can arrive. What do you do in this situation? Now, you've got to look at it like this. We talked about it earlier. They're not dead until they're warm and dead if it involves hypothermia. So you've got to look at the situation. Their body temperature is obviously down. You've got to start that CPR, and you've got to get them somewhere where they can be rewarmed before they can actually be determined to be dead. Automated external defibrillation, or the use of an AED. Alright, external defibrillation, this is done by defibrillators. Delivers an electric shock that stimulates the heart to begin beating normally. Manual defibrillators, these are used by your paramedics. They will have to interpret the heart rhythm, and ALS providers decide whether the patient should receive an electrical shock. AEDs, they assess the heart rhythm automatically. They determine if defibrillation is necessary. Recognizes VFib and VTAC. Delivers an electrical shock when needed. Not effective when there is no electrical activity in the heart. They're also not going to respond to a systole or PEA. This is just some examples of different kinds of AEDs that are on the market today. Alright, basic warnings for the use of AEDs. You always want to follow precautions. Only place AED on the patient who is in cardiac arrest. Do not place defibrillator patches over a medication patch or implanted pacemaker. Ensure no one is touching the patient before you deliver a shock. Right, do not attempt to assess or shock a patient who is moving. Do not attempt to defibrillate a patient who is lying in water. Do not attempt to defibrillate a child under 1 year of age. Something to think about when it says do not attempt to defibrillate a child under 1 year of age. The instance of a child going into ventricular fibrillation or VTAC causing the cardiac arrest is almost zero. So they're telling you this, the likelihood of them actually being in a rhythm that can be helped by defibrillation is slim to none. Most of the time they're going to be in a systole or PEA. All right, when do you want to place an AED? If the patient is in cardiac arrest, which means they have no carotid pulse and they have no normal respirations. If you do not have an AED, just continue CPR. All right, attaching the defibrillator. All right, it's got to be to the patient's bare chest. So remove any clothing that may be in the way. Place electrodes on the patient's dry, bare chest, one at a time. Ensure that the electrodes are firmly plugged into the device. Once you've confirmed the patient is unresponsive and has no pulse, turn on the AED and bare the patient's chest. Place the pads and connect the cable to the device if it's not already connected. When prompted, clear the patient and press the shock button. That's only if it's indicated. It'll decide if it wants you to deliver a shock or not, and it will tell you whether you should or not. After delivery of the shock, immediately begin chest compressions. This is the correct placement of AED electrode pads on the individual's chest. They are marked. Operating the fully automatic AED is going to assess the patient's heart rhythm. It's going to determine if a shock is indicated. It's going to charge to the preset energy level. There's nothing you have to do with that. The AED is going to deliver a shock to the patient without further input from the rescuer. Many have voice and text prompts, so they'll tell you exactly what to do and when to do it. All right, this is going to be operating a semi-automated defibrillator. It's going to analyze the rhythm. It's going to advise you if the shock is necessary. Some models require a rescuer to push the button to begin the analysis. Most do not. It's going to charge to the preset energy level. The rescuer pushes the button to deliver the shock. Potential problems with AEDs. You can have loose cable connections. Poor attachment to the pads. This can be caused by a hairy chest or a wet chest or medication pads. If it's because of a hairy chest and you have a second set of pads, you can go ahead and apply the first set. Rip them off quickly. It'll remove most of the hair that was in the area of the pads, and you can put the secondary set on. If you have a razor included in your AED, you can go ahead and try to quickly shave a portion of the individual's chest. A wet chest just needs to be wiped with a towel or any type of clothing prior to application of the pads. Medication pads need to be removed and then the residue wiped off with something prior to putting the pads on. You can also have error messages and alarms that constantly go off. All right, with AEDs, you want to focus on standard operating procedures, physician-directed standing orders, care delivered by rescuers, performance of the equipment, routine maintenance of the equipment, the effectiveness of your training programs. All right. You and your partner respond to a gas station where a 68-year-old man was found slumped over the wheel. You remove him from the vehicle and place him on the ground and begin resuscitative efforts. You apply the AED and hear no shock advised. What steps do you need to take next? All right. If there's no shock advised, you're immediately going to go back into your CPR. Just pick up where you left off and continue until ALS arrives. All right, summary. Chain of survival is linked to the system of patient care events, immediate recognition and activation of EMS, early CPR, rapid defibrillation, effective advanced life support, integrated post-cardiac arrest care. Survival of the brain is dependent on activities of breathing and circulation. Major signs of cardiac arrest are no pulse, unresponsiveness, no breathing. If a patient is unresponsive, check for signs of breathing. If the patient is not breathing or only gasping for breath, call 911 and check for the pulse. Again, you guys are going to be responding as the 911 rescuer, so you're going to be there after 911 is activated. If the patient has no pulse, begin chest compressions immediately. If you are alone caring for a pediatric patient, provide 2 minutes of CPR before leaving the child to activate 911. Again, you're going to be there after the activation, so this doesn't really apply to you. To provide proper CPR, place the patient supine position on a hard surface. For an adult, provide compressions at a rate of at least 100 per minute and a depth of 2 inches. For a child, provide compressions at a rate of at least 100 per minute and compress the chest about 2 inches. For an infant, provide compressions at a rate of at least 100 per minute and compress the chest 1/3 the depth of the infant's chest, or about 1.5 inches. After 30 compressions, provide 2 rescue breaths, then begin compressions again. Do not stop CPR for more than 10 seconds for any reason. Continue CPR until the patient regains pulse and breathing, or until you are relieved by another highly trained individual. AEDs, or automated external defibrillators, are electrical devices that convert certain lethal heart rhythms to normal cardiac rhythm. Must be used with caution and according to specific protocols. General steps for use of an AED. You got to confirm the patient is unresponsive and has no breathing or pulse. Turn on the AED. Expose the patient's chest and securely attach the pads. Wipe dry or shave any hair if necessary. Follow AED's prompts to defibrillate and check breathing and the pulse. Follow the AED's prompts to check for pulse or start CPR if there is no pulse. Here's some review questions. What are the most common causes of cardiac arrest for adult and pediatric patients? Adult patients are generally going to have some type of cardiac etiology. Pediatric patients are going to have generally an airway or breathing issue that has caused them to go into cardiac arrest. What are the components of the adult chain of survival? It's going to be recognition of cardiac arrest and activation of the emergency response system. Early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. Rapid defibrillation. Basic and advanced emergency medical services. Advanced life support and post-cardiac arrest care. What are the signs of cardiac arrest? No pulse, no respirations. What are the steps for performing single rescue or CPR on an adult, child, and infant? I'm going to give a brief answer on this. You can reference your book for a more detailed answer. So the steps for performing single rescue or CPR on an adult, child, and infant are going to be to initiate CPR. Everybody's ratio is going to be 30-2 with a single rescuer. So that's going to be 30 compressions to 2 ventilations. Same thing for number 5. I'm going to give a brief answer. What are the steps for performing 2 rescue CPR on an adult, child, and infant? Again, this is going to be providing basic CPR. The only difference is on a child and an infant, your ratio is going to go from 30-2, and you're going to swap it over to 15-2. So that's going to be 15 compressions to 2 ventilations. Those are the biggest differences between 1 and 2 rescue or CPR. Again, with children and infants, you're going to go from a 30-2 ratio and you're swapping over to a 15-2 ratio. What is the purpose of an AED? Purpose of AED is to recognize lethal cardiac rhythms such as ventricular fibrillation, or VFib, or ventricular tachycardia, and it's going to deliver an electrical shock to reset the heart into a normal rhythm. All right, what are the indications and contraindications for the use of an AED? All right, so indications are someone that is in cardiac arrest. The biggest contraindication is going to be somebody less than 1 year of age. It's generally not indicated to use a AED. Like I said earlier, somebody that age, the chance of them being in cardiac arrest from a lethal rhythm such as VFib or VTAC, which are the only rhythms that an AED is going to recognize, is almost none. Right, why is it so important to minimize interruptions during CPR? So when you're doing CPR, you're actually creating perfusion. You're making it possible for the body to be perfused. So when you're stopping, that pressure is actually dropping while you have stopped, and it takes time to build that back up. So if you're constantly stopping CPR, you're not perfusing the body adequately, and the chances of survival just decrease substantially. All right, this concludes chapter 11. If you guys have any questions, please feel free to reach out to me.
Ventricles to the atria. Some blood flows passively from the atria to the ventricles at this time.
Cardiac cycle, it may or may not come through.